Sepsis is a life-threatening condition that arises when the body's response to an infection injures its own tissues and organs. But according to the statistics from Gulu Regional Referral Hospital, from the year ending 2019-2020, the health facility registered high death rate of 1,688. The district health officials have attributed the high death rate to all forms of sepsis that is majorly due to poor hygiene.
One of the conditions which is causing maternal death is sepsis. Hygiene-related conditions. Yes, so when the hygiene is not good, those are the conditions sometimes which we develop. So we emphasize hygiene in maternity unit, hygiene of mother, hygiene of baby, at home, in the maternity, so that the babies don't die due to sepsis. Yes, and making sure the handling of the baby, you wash your hands very well.
The district health officer, Gulu Idiba says mothers who delivered in places of poor hygiene or their children are at high risk of catching the sepsis.
2019-20, we had 1,688, among which 8.8% were due to sepsis. Those deaths was going to be due to sepsis. And then pneumonia, 8.3, malaria, 7.8, anemia, 6.2, cardiovascular disease, the heart issues, heart disease, 6.1%.
Idiba believes that poor state of health facilities in the district and increasing deliveries at home by traditional birth attendants could be triggering the high cases.
We don't want mothers to deliver at home because of these conditions. Sometimes they want to push at home and they end up going to hospital because of the sepsis conditions.
It was last month when two mothers were brought in an ambulance, and it was like manslaughter in that ambulance, because one was pouring blood like water in the tap, and one was already in the late stage of labor, and the baby in the womb is already not alive. So in that scenario, pain almost each and every one here, including even the gynecologists which we have here.
The health experts are now challenging expectant mothers to plan ahead of their labor to avoid delivering by the roadside on their way to the hospital.
We want them to be delivered by qualified trained midwives, health workers, who can easily manage such conditions.
Gulu health officials have now embarked on revamping all district health facilities, but more importantly, ensure hygiene in all health facilities.
One of it is requiring for referral system to be improved. We need more of the ambulances to support our rural area. One ambulance, which is DMC, cannot move the entire district and manage. Yes, it requires also a central command ambulance. Network issue sometimes disturbs us, and find that now the mother dies at facility and we call it a facility death. Where is it from the community? Conditions
like fever, a higher heartbeat, and breathing rate. In Gulu, sepsis is considered the leading killer disease at 8.3% of the death, followed by malaria at 7.8%, anemia 6.2%, cardiac arrest 6.1%, among others. Job Ronocott, NBS, Live at 9.